This is our COVID Roundup and CDC update for May 3rd, 2024. Due to the ending of the mandated COVID hospitalization reporting, this number is now no longer accurate and should not be used. However, interestingly, COVID deaths have plateaued. For the time being, that number should still be useful and should still be valid as a very lagging indicator of COVID infections. To give you more information, this is what you see if you go to the COVID hospitalization map. It reads, effective May 1st, 2024, hospitals are no longer required to report COVID-19 hospital admissions, hospital capacity, or hospital occupancy data to HHS through CDC's National Healthcare Safety Network, NHSN. The data will be archived as of May 10th, 2024, and available at weekly United States COVID-19 hospitalization metrics by county and weekly United States COVID-19 hospitalization metrics by jurisdiction. CDC encourages ongoing voluntary reporting of hospitalization data. Data voluntarily reported to the NHSN after May 1st, 2024 will be available starting May 10th, 2024 at COVID Data Tracker Hospitalizations, which sounds like good news. However, the CDC has not said how they're going to standardize this, what their normalization techniques are going to look like, because to give you a scenario, you could have a state that has many hospitals in it, and only if a small subfraction of those hospitals are reporting, are they then going to be comparing just those hospitals and trends to those hospitals in the past years, in the past weeks. I don't think they came up with a plan that far in advance. So I think this will be used for people that don't understand the data to be like, oh yeah, COVID numbers are going down. They're the lowest they've ever been, when the data is inherently faulty and flawed. So you're going to see news outlets and other places report instead on the trend in test positivity and the trend in percent emergency department visits. I made a video on this before on why those two are inherently flawed, but I'll do it again. So for the trend in percent test positivity, this is only people that are hospitalized, that are being counted, that are involved with hospital networks. And it's only going to be nucleic acid amplification tests, the NAAT, like PCR. They're not going to be including rapid antigen tests in that test positivity number, which takes out a huge proportion of individuals that test positive for COVID. And then since these aren't covered mainly on insurances, so most people aren't going to have the money to afford those tests, which whittles the population of individuals being tested even further down, meaning that the only test positivity numbers are those that can afford the test, that go to the hospital to get the test, that have in-network insurance, and who request the test because, as many people have stated, hospitals don't even require the testing anymore for COVID. So it's an inherently faulty number and should not be used as an indicator. Same exact thing with the trend in percent emergency department visits. So they're not looking at the whole hospital. Their trend in hospital admissions was looking at the whole hospital with COVID cases. These are just severe COVID cases. So any mild or moderate COVID cases would not be considered in that number. And again, you would have the same issue with the test positivity cases in that these are people that have insurance, that can afford the test, that want the test, that request the test, and that have a severe enough a case to warrant even the consideration of it. So again, an inherently faulty number. So really, from this little mini snapshot view, the only thing that I will continue to report on is the COVID death numbers, and I'll keep an eye on that data. For the time being, that data should be accurate. There are no plans for current changes in the reporting of that, but if I see something, I'll say something. Now, if you're still here, thanks. Let's move on to the wastewater data. Looking at our New York State wastewater map, there's still 58 wastewater facilities that have consistently not been reporting. This is a very concerning trend for New York. It's been several months now that many of these wastewater facilities have not been reporting, especially in this Long Island area. As a reminder, anything that is dark blue is low levels of COVID in the wastewater. Anything that is light blue is moderate levels, and anything from yellow to bright red is high levels of COVID in the wastewater. As can be seen, the majority of wastewater facilities are reporting moderate levels of COVID in the wastewater, which should be noted is not low levels of COVID in the wastewater. And the number of reporting wastewater facilities reporting at the high levels has dropped from about 42% down to about 37%. Moving on to the 58 reporting wastewater facilities to wastewater scan, looking at California. Overall, the vast majority of wastewater facilities, denoted by this dark blue concentration down here, is holding relatively constant. However, what concerns me is all of these spikes. These wouldn't be considered noise in the data. These are clear signals. And it's a little worrying to me seeing these types of signals where it just blasts off. Looking to the 194 wastewater facilities that report to wastewater scan, we see a similar trend where the dark concentration of wastewater facilities appears to be heading slightly downwards. However, again, what concerns me is these spikes. These spikes are not insignificant and could be a sign of a pretty strong variant coming out, possibly the KP2 variant. And then, according to our COVID Iowa 19 tracker, the top 5 states in terms of viral activity are Oklahoma, Hawaii, New Mexico, New Hampshire, and Minnesota.